Good afternoon. A lot of people have been asking who am I to be giving medical advice on various medical problems. Well, my name is Dr. Lasso Odiseng. I'm a specialist in sports and exercise medicine. I'm a specialist in occupational medicine. I'm also a principal in family medicine. All my medical training from undergraduate level to postgraduate level was done in the United Kingdom. I worked for over 15 years as a specialist in the UK, but now I'm based in Botswana, Bokamoso Private Hospital, running a clinic called Moso Clinics. That's where I'm based. I do mainly musculoskeletal problems and some occupational medicine. Now, today I'm going to talk to you about what's called intravenous nutrition therapy. The name is not right for what they are doing, because therapy implies that you are treating something. In fact, they should call it intravenous nutrition infusion, because they're infusing something into your venous system. Essentially what this means is that they put a needle or a cannula into your vein, and through that they will put fluid that has got nutrients directly into your body system. Normally what they do is that they put multivitamins, minerals, or sometimes amino acids into the mixture that was put directly into your body. Amino acids that they normally use are vitamin C, B12, vitamin D, and magnesium, calcium, and other minerals. Now, there's a claim that this procedure can treat migraines, chronic fatigue, fibromyalgia, muscle spasm, pain, allergies, sinus and respiratory tracts. Well, I can assure you that best care that this does not do that at all. If you are dehydrated and you're a bit tired because of dehydration, or say you have a hangover, yes, putting any form of fluid into your body will make you feel better. Particularly that best care that if you've been drinking too much the night before, you may be low in sugar. Therefore, any fluid that's got sugar in it will make you feel better. Now, there's been claimed that this form of treatment of this form of procedure can make you better looking. Well, I'm not buying that story, but if you're dehydrated, obviously your skin looks terrible, and then when you hydrate yourself, you look a little bit better. But no, it does not work. They say that it can make you lose weight. Well, if you're only taking that, a little bit of that every day for the next 30 days and nothing else, obviously you lose weight because you're not taking a lot of excess carbohydrate proteins and protein. So that's how you could possibly lose weight. But otherwise, it does not make you lose weight. I understand some general practitioners give this without examination. That's wrong. You need to be examined. You need to have a blood test to make sure you do not have any contraindication. For instance, if you've got heart failure, you are likely to go into worse heart failure. If you've got kidney failure or liver failure, you are likely to run into trouble. What are the problems with the intravenous therapy? Well, since you're going to be piercing the skin to put the cannula into your skin, you could introduce infection. Not a nice thing. You could have blood clotting in that area, and that blood clot will go into the right side of the heart and goes into your lung, causing what's called a pulmonary embolus that could kill you. You could introduce a bit of air into your system. This will travel the same way as the blood clot, cause an air embolus and kill you. So, really, is there any advantage of this? Well, traditionally it was used for treatment of certain medical conditions. If you have some deficiency and you are not able to absorb food, then you could have that type of therapy. If you have upper airway, upper alimentary tract obstruction of some form, say you have trauma to the mouth or you can't eat, then intravenous infusion of nutrients is the right way to do it. We call it total parenteral nutrition, TPN. You do it in people in ICU because they cannot eat. You give it to people who have had bowel surgery because you want the bowel to rest. You can give it people with malabsorption that I've already said. People who have problems with absorbing nutrients. Yes, because they can absorb the nutrients, so putting directly into the blood system is fine. Now, let's just look at it. There's no advantage if you are fit and healthy at all, because you can take those nutrients by mouth with very little risk or no risk at all. Now, I understand this costs 1,500 pula for a 30-minute, 30 to 1 hour consultation or treatment session. That's a lot of money for 30 minutes. Now, with 1,500, you can go and buy yourself some meat, a goat, for instance, costs about 800 to 1,000 pula. You can go and buy yourself pap, maize flour, you can buy yourself flour, make bread, you can buy yourself spaghetti, you can buy yourself samp, and then you can also buy yourself fruits and vegetables to feed your family. That will last a month, or even 2 months, or even 3 months, instead of a 30-minute treatment session. I mean, it doesn't make sense to me for someone to spend so much money on something that does not work, and in fact will be dangerous. It's a total waste of money. Yes, someone may look like a very good doctor. They're telling you this and that, you're going to look this way. You've seen some celebrities who are looking good using this type of thing. Now, really, from the medical perspective, I don't think this should be done. Shouldn't be done at all. It could kill you. It's not safe. So you got to think very carefully what you want to do. It's up to you, the individual, to decide what to do. I don't think this is regulated in this country in Botswana. So, I mean, you got a choice to make. Take good care.